Earlier, I spoke to Jonathan Gruber, one of the main architects of the healthcare law, and asked him if the Obama administration is feeling more confident with this relaunch of the site.
I think working is a difficult term to define. I think there's a lot of confidence that most people who want to get health insurance will be able to shop for it effectively on the website. That's the first step. The second step is how effective are enrollments. I think it's going to take a little time to see. But I think that the main thing the administration has been emphasizing, and really thoughtful people about this have been emphasizing, is we have time. You know, the real key deadline is the end of March. That's the close of the open enrollment. That's when we need to get people in particular young and healthy people in. So there's still time to work this out.
Right, you say there is time, but the president, the administration, and the people who support this law are also fighting the politics of the law. There are people who criticize this law, who want to see it roll back.
That's absolutely right. This is really unprecedented in U.S. history, as far as I know, to have the opposition to a law simply grow once it's passed, rather than, usually we have these fights and the law passes and then we move on. Not in this case. So they're facing a very difficult political environment. But once again, the advantage is time, and the opponents know that. The opponents are going to try to really force the issue, but supporters of the law know that time is on their side, because over time the website will work better, more people will be enrolled, and the law's success will show through.
Right, this kind of health insurance is not new. It has been tried out successfully, I should say, in the state of Massachusetts here in the United States. That was very successful. You were involved in that. How did that roll out?
That rolled out more slowly and with much less attention to day-to-day details. The very first month that people could pay and sign up for health insurance in Massachusetts, 123 people did. By the end of the year, that number was 36,000. Now, what's striking is two things. First of all, it ramped up slowly. Second of all, that's not even a number I knew until I went back and looked it up a month ago. This is just not something we were that focused on. We realized we had some time to ramp up, and we didn't have the kind of opposition that was making us focus on every single number that came out.
Right, in terms of the numbers of people who have to enroll on these websites in order to get insurance, what are the sort of markers that we would be looking for, the benchmarks that we'd be looking for in the months ahead?
I think really the only benchmark that really matters is what happens to insurance rates in 2015. And that's because that's going to really, what matters is not how many people sign up. There'll be enough people to sign up, quote unquote. The systems aren't going to collapse because of a lack of demand. What matters is the health mix of those who sign up. Do we get enough of a mix of healthy and sick signing up that insurers don't have to jack up their rates a lot in 2015? So in some sense, the key deadline, the key date to keep an eye on is what happens to rates in 2015 when we see who's signed up and how insurers react.
Right, I guess insurance works on the basis that not everybody's going to be sick at the same time. So one of the key demographics that the administrators of this will be looking for is the number of young people who register for health care. And do we know anything about those figures right now? Or, is there anything that compels young people to register?
Well, in terms of what we know, we don't know much at the national level right now. We do know in Massachusetts, at the beginning of our process, only about 24% of the people who signed up were under age 35. As the year went on and we approached the deadline, which in our case was the end of the year, and this national law is March 31st, that share rose enormously. So I think we'll see that. In terms of why would young people sign up, there's a number of reasons. First of all, a lot of young people want health insurance and have been unable to get it because of our broken insurance markets. Second of all, there are enormous subsidies that's going to make health insurance affordable for young people or low income. And third of all, there's an individual mandate, which will penalize young people if they don't sign up for health insurance.
As you mentioned earlier, there is a lot of opposition, political opposition to this law. Why is there such opposition, especially from the Republican Party here in the United States, to the Affordable Care Act?
Look, I don't see any answer you can give other than ugly partisan politics. The Affordable Care Act is based on what we did in Massachusetts. What we did in Massachusetts is based on conservative principles. Okay, indeed, when we signed our law in Massachusetts, at the podium was a speaker from the Conservative Heritage Foundation to talk about what a good law it was. And 3 years later, President Obama puts his name on basically that same law, and suddenly it's the devil's work. There is no answer other than just the ugliness of the partisan politics in the U.S. today. Right,
and of course the opposition is not clear-cut as well, because there is a significant number of people who oppose this law because they think it doesn't go far enough.
That's what's quite interesting. That number has shrunk. When the law was passed, I would say a lot of the opposition was that. I think a lot of those on the left who opposed it because it didn't go far enough have realized that that the law is the most they're going to get in a long time, and I think many of them have come on board. But I agree, the passionate the passion in defense of the law is not as strong as it might be, because many of those most passionate supporters really wanted even more than the law could deliver.
Jonathan Gruber, thanks for joining us.
My pleasure.